The President, Nana Addo Dankwa Akufo-Addo, in his address to the nation on Sunday, stated that Ghana's active case count had decreased from 3,307 on July 24th to 1,847 on August 15th. However, Dr. Joseph Bonney, a senior research fellow at the Noguchi Memorial Institute for Medical Research, in an interview with Citi News, cautioned against seeing the drop in active cases as a true reflection of the status of the pandemic in the country.
We can, yes, celebrate because we are not getting more cases. But also we can't think that we are out of the woods yet, because we have not tested, or we are not testing everybody. We only test people who are showing symptoms. But we know that people are around who can transmit without showing symptoms.
Speaking on testing, Dr. Bonney shared some of the challenges Noguchi has had in its 5 months of dealing with the pandemic.
When we started July, at the beginning of July, things started becoming better for us because the samples that were coming in reduced. Then also we got the reagents back. So that gave us the time to be able to clear the samples that were stuck as a backlog. So for July, we were able to do all that. And if you come in there, you will not see that samples are packed, that are waiting to be processed. But we were still having people who were calling in that their results has delayed. That means, yes, we have worked on it to some point, but we have not been able to come up with their results. So there was still some backlog in there.
He further explained innovative methods the center adopted in clearing the backlog.
For the virus we are dealing with, it comes with an RNA. So we need to extract that RNA from the clinical sample, whether it is sputum or a throat swab. We have to take that one from it, then go on and test it. And we had a machine that can do that automation. So it really made us go very fast. We had 2 of that machines in July, towards the end of July. Now that is the middle of July. So we're able to clear all the backlog, that is the samples that have been processed that were waiting to do the PCR, the polymerase chain reaction. So we're able to do that.
Dr. Bonney gave an insight as to what could have accounted for the drastic drop in active cases.
We used to get roughly around between 3,500 and 4,000 samples, that is clinical samples from hospitals that were bringing their samples here from April. Let's say from towards the end of March to April on a daily basis. So you can get an average of 3,500. We get roughly about 500 to about 1,000 samples on a daily basis. So it has really gone down. We are seeing a lot of negative cases now, and also we are not getting enough samples to test. We are not doing mass testing again. So if you don't test, you don't see. So you are not going to see anything. But the samples that we are getting to, we are seeing a lot of negative cases from it.